What if I told you that despite following your glaucoma treatment plan, your medication might not be doing its job? It sounds surprising, but many people unknowingly experience this. Glaucoma can silently progress, often without obvious symptoms until it's too late. Today we're going to uncover 5 signs that your glaucoma medication isn't working as it should, and more importantly, what you can do about it. Are you noticing changes in your vision, experiencing more discomfort than usual, or struggling to stay on top of your treatment? In the next few minutes, we'll break down these signs and offer actionable solutions to help you manage your eye health better. Stay with me, because if you catch these signs early, you can protect your vision and stay ahead of the game. Sign 1. Vision changes despite medication. Glaucoma is a condition that can be difficult to detect. It often progresses slowly, causing gradual vision loss without much warning. The problem is that it typically affects peripheral vision first, and the changes can be so subtle that it's easy to miss. If you've been following your glaucoma medication regimen, but notice your vision getting worse, maybe you're squinting at the TV or having trouble seeing in dim lighting, it could be a sign that your medication isn't working as effectively as it should be. You might be wondering how this could happen if you've been using your eye drops consistently as prescribed. According to a 2019 study in the American Journal of Ophthalmology, about 50% of people with glaucoma aren't taking their medication as prescribed. Some forget, others might not take it consistently, and some stop altogether if they feel it's not working. When your medication isn't being taken as directed, or isn't the right fit for you, eye pressure can rise, leading to vision loss over time. This isn't something to ignore. High intraocular pressure, IOP, is one of the main factors in glaucoma progression. So what can you do? If you notice any changes in your vision, even small ones, it's time to track them. You could keep a journal to note when you see blurry spots or have trouble seeing in certain lighting. Once you have a clearer picture, schedule an appointment with your eye doctor. They might adjust your prescription or recommend a different type of medication. Sometimes, it's just a matter of finding the right fit for your eyes. A helpful tip: try using a medication reminder app. These can help you stay on top of your doses, especially when life gets busy. It's easy to forget, but a reminder can help you stay consistent with your treatment. If this sounds familiar, you're not alone, and the good news is that adjustments can be made to get your treatment back on track. But the sooner you take action, the better, since untreated glaucoma can cause irreversible damage. Sign 2. Unexplained eye pain or discomfort. If you've been following your glaucoma treatment but suddenly feel persistent eye pain, burning, or frequent redness, it could be a sign that your medication isn't the right fit. Some treatments, like beta blockers or prostaglandin analogs, are known to cause irritation. A 2020 study in the Journal of Glaucoma found that 17% of glaucoma patients experience discomfort, including stinging or burning, from these medications. But the discomfort might not just be a side effect. It could also mean that your eye pressure is still too high, which could lead to more serious complications over time. If you're frequently squinting or rubbing your eyes, it's time to address it. Don't assume it's just part of the treatment. If the discomfort persists, talk to your doctor. They might adjust your dosage, suggest a different medication, or even recommend surgical options like laser treatment if necessary. Keep track of your symptoms, as this information will help your doctor decide the best course of action. Managing glaucoma isn't just about taking medication, it's about staying proactive and attentive. If you've noticed discomfort or redness, don't ignore it. Talk to your doctor about alternative treatments. But let's move on to another challenge many face with glaucoma: sticking to the prescribed regimen. Sign 3. Difficulty following your prescribed regimen. Managing glaucoma can be challenging, especially when it comes to sticking to your treatment plan. Even if you're on the right medication, consistency can be tough. You might forget a dose or struggle with applying your eye drops correctly. You're not alone in this. It can feel like a constant juggling act. The key isn't just taking the right medication, it's taking it consistently. A 2018 study in ophthalmology found that only 50 to 60% of glaucoma patients stick to their prescribed regimen. Missing doses or not following through can cause your eye pressure to rise, increasing the risk of vision loss. If you find yourself forgetting doses or struggling with your regimen, don't be hard on yourself. Life can get busy. Consider setting alarms on your phone or asking a family member to help remind you. Newer treatments, like once-a-day eye drops, may also make it easier to stay consistent. And if your treatment feels overwhelming, talk to your doctor about alternatives, including surgical options that could reduce the need for multiple medications. The key is staying consistent. The more you follow your regimen, the better the outcomes. But if the issue isn't adherence, it might be the side effects of the medication. Sign 4: Medication side effects. Medications are supposed to help, but they can sometimes come with unwanted side effects, such as blurry vision, headaches, or fatigue. While side effects are common, they can be especially troublesome when managing glaucoma. The last thing you want is to deal with discomfort on top of eye pressure. If you're noticing stinging, burning, or blurry vision after using your eye drops, it could be a sign that your medication needs adjustment. A study in the British Journal of Ophthalmology found that 50% of glaucoma patients stop their medication due to side effects, such as burning from eye drops or low blood pressure from oral treatments. These side effects aren't a reason to stop your medication without consulting your doctor, but they do indicate that your treatment plan may need tweaking. If certain eye drops are causing discomfort, your doctor might suggest a different type of drop or a medication with fewer side effects. To help, keep track of your symptoms. Note when they occur and how severe they are. This will help your doctor adjust your treatment. Additionally, combination therapies, which combine different treatments into one drop, may help reduce side effects. If you're struggling, don't hesitate to ask your healthcare provider about this option. Staying on top of side effects is important because the goal is to manage glaucoma effectively while minimizing discomfort. Sign 5: Lack of effectiveness over time. Over time, medications can lose their effectiveness, and glaucoma treatments are no exception. What once worked well for managing your eye pressure might not be as effective after a while. You may notice your intraocular pressure, IOP, creeping back up and your vision deteriorating again. This happens because, as we age, our bodies can develop a tolerance to certain medications. A study in the Journal of Ocular Pharmacology and Therapeutics found that some medications, like prostaglandin analogs, can become less effective after several years of use. If your eye pressure is rising despite following your treatment, it's important to talk to your doctor. Don't assume your medication is still working just because you're using the same one. Regular eye exams and measuring IOP are crucial. Your doctor may suggest changing medications, increasing the dosage, or even adding a combination therapy. In some cases, surgical options like selective laser trabeculoplasty, SLT, could help. The takeaway: don't rely on past effectiveness. Stay proactive with checkups and monitor changes closely. With the right adjustments, you can continue protecting your vision for years. Managing glaucoma isn't one size fits all. If you've noticed changes in your vision, uncomfortable side effects, or your medication isn't working as well as it used to, there are options to adjust your treatment. Start with medication adjustments. If your current treatment isn't effective or causes discomfort, talk to your doctor. Newer medications or combination therapies, which combine multiple treatments into one drop, could work better and help reduce side effects. If your treatment feels overwhelming, these simpler options could make a big difference. Sometimes, medication alone isn't enough. If your eye pressure isn't being managed, surgical options like selective laser trabeculoplasty, SLT, may be an option. This procedure helps reduce eye pressure by targeting the trabecular meshwork, offering a less invasive alternative to traditional surgery. Monitoring and consistency are key. Regular eye exams with your ophthalmologist are essential to track your intraocular pressure and adjust your treatment. If you notice symptoms like eye discomfort, blurry vision, or headaches, don't wait for your next checkup. Talk to your doctor right away. Advancements in glaucoma treatment, like combination therapies, are proving more effective at reducing eye pressure and minimizing side effects. So even if your current medication isn't working, there are plenty of options to improve your eye health. Stay proactive, stay consistent, and don't hesitate to explore different treatment options. Whether through medication, surgery, or regular checkups, you have the tools to manage your eye health and protect your vision. Now that you know how to spot when your glaucoma medication isn't working, it's time to take action. Are you ready to protect your vision and stay ahead of the game? The more proactive you are, the better the results. Whether it's adjusting your medication, exploring surgical options, or staying consistent with doctor visits, small steps today lead to big benefits tomorrow. If this video helped, give it a thumbs up, share it with someone who could benefit, and don't forget to subscribe for more health tips. Turn on the notification bell so you never miss out on the latest updates. Got questions or thoughts? Drop them in the comments. I'd love to hear your experiences. And for more health insights, check out the next video on your screen.